Hello classmates, welcome to the online class of Chinese medical gerontology. Today we will study the first part of the chronic obstructive pulmonary disease. First, learn the definition of COPD and the understanding of Chinese and Western medicine. Chronic obstructive pulmonary disease, abbreviated as chronic obstructive pulmonary disease or COPD in English, is a disease that can be prevented and treated by progressive and persistent airflow limitation. Elderly people mostly develop from repeated attacks of chronic bronchitis. The disease mainly affects the lungs and can cause damage to multiple organs outside the lungs. Its acute exacerbation and complications affect the course of the disease. As the disease progresses, it can lead to a decline in quality of life, loss of labor, and eventually respiratory failure and pulmonary heart disease. This data program shows that the higher the age, the higher the prevalence of COPD. COPD belongs to the category of pulmonary distension, asthmatic syndrome, and phlegm drinking in Chinese medicine, and is closely related to syndromes of cough, palpitations, and edema. Modern medicine is not very clear about the exact cause of COPD, but it is generally believed to related to the following factors that cause chronic bronchitis. The currently known causes and risk factors are: first, smoking, and second, air pollution, such as harmful gases in the atmosphere, sulfur dioxide, nitrogen dioxide. 3 is occupational exposure, such as occupational dust and chemical substances. And 4 is infection factors, such as virus, bacteria, and mycoplasma. Let's look at the signal characters of COPD from the perspective of Western medicine. After entering old age, the structure or function of the respiratory system continue to decline. In fact, the pathologic changes of COPD mainly manifested as the pathological changes of chronic bronchitis and emphysema. The pathological changes are located in central airway, peripheral airway, lung diaphragm, and the vascular system of the lungs. Is mainly manifested in the repeated cycle of airway damage repair process caused by chronic inflammation, formation of airway wall reconstruction, collagen increase, scar formation, causing tracheal stenosis, leading to airway obstruction, destruction of pulmonary capillary bed, and thickening of pulmonary blood vessel wall, causing pulmonary hypertension. Due to the weakened immune infection of the elderly, it may be affected. There are some chronic diseases that are prone to diseases such as upper respiratory tract infections or lung infections, which exacerbate chronic inflammation of the respiratory system. So, repeatedly, the disease continued to progress. How does Chinese medicine understand the etiology and the pathologies of COPD? Old people's qi and blood yin and yang gradually become deficient, and it is easy to be tracked by oxygen factors. Respiratory tract infections are repeated in winter and spring or during the season change. Long-term illness is lung deficiency. Phlegm is retained in the lungs, and the airway is blocked. These diseases are formed. To sum up, there are three causes. One is chronic illness and physical weakness, indicating a long course of disease. The other is complex sensation of external evils. Easy to feel the six kinky external evils, including or aggravated the disease. The third is qi stagnation, phlegm, blood status, and blood interconnection. Phlegm and blood status are pathological products and physiological factors and have the role of enhancing the past. Throughout the course of the disease, stagnation, phlegm, water, and the blood status are main pathological factors of COPD. The three influence and transform each other. In the early stage of COPD, qi stagnation and phlegm turbidity are dominant, and then phlegm turbidity and blood status are marginally seen. Later, phlegm turbidity, blood status, water drink, and lung, spleen, and kidney, qi and yin and yang are mixed. Now, briefly talk about the main points of the diagnosis of COPD and its relationship with the syndrome of traditional Chinese medicine. The diagnosis of syndrome is as simple as one sentence. If you have chronic cough, staptoma, shortness of breath, or difficulty breathing, wheezing, chest tightness, syndromes, or signs, you should consider the diagnosis of COPD. Of course, the diagnosis needs to be combined with a comprehensive analysis of history of high-risk factors, clinical syndromes, signs, and lung function tests. Among them, incompletely reversal airflow limitation is a necessary condition for the diagnosis of COPD. After inhalation of bronchodilators, the predicted value of FEV1 to FEVC less than 70% and FEV1 less than 80% can be determined as incompleted reversal airflow limitation. Non-cough statum systems. Only FEV1 to FEVC less than 70% during the lung function test and FEV1 more than 80% of the expected value after excluding other diseases. It can also be diagnosed as COPD. With increasing age, the defects of lung elastic retraction can naturally occur airflow obstruction. This critical value will cause essential diagnosis of the elderly to the center existent. For most elder people, FEV1 to FEVC less than 60% is abnormal. Attention should be paid to clinical diagnosis. COPD belongs to the categories of lung distension, asthma syndrome, and phlegm drinking. Among them, due to the similar clinical characters, the relationship between COPD and lung distension is particularly close. We summarize the clinical manifestations of pulmonary distension as six elements: cough, statium, asthma, swelling, and purple. Helps to better grasp the clinical manifestations of COPD. These false standards and false are real the characters of COPD. The position and the false are often the cause and effect of each other, resulting in more and more disease. The disease is in the lungs at the beginning, involving the spleen and the kidney, and later in the heart, according to the time period. The early stage is most statium turbidity, or phlegm heat stagnation of lungs, and then gradually from qi and blood, forming phlegm turbidity and blood status and interlocking. Later on, qi deficiency develops into yang deficiency, resulting in spleen and kidney yang deficiency. When the water is wet and overflows, the overflowing skin becomes swollen limbs, and the upper heart and lungs cause swelling. Phlegm turbidity and phlegm heart syndrome can occur at various stages, but the degree of positive deficiency is difficult. In clinical practice, due to the long course of COPD, traditional Chinese medicine have a long-term illness. So blood status runs through the entire progress of disease development. At present, both Chinese and Western medicine in clinical practice emphasizes the use of drugs for promoting blood circulation and removing blood stasis, such as Danshen, Transhiung, and its intravenous preparations. We have learned the knowledge of Chinese and Western medicine on etiology, physiology, and diagnosis of COPD above. I hope that students will carefully sort out and summarize after class. Okay, that's all for today's class. Thank you.